So just to give you a bit more detail on the 4 main points of the policy. So we are moving to a named peer review policy whereby the review author and peer reviewer know each other's names and affiliations during the process. And this is really to help us be more consistent with Cochrane's core principles, which include open and transparent communication and decision making. This type of peer review has been adopted by many medical journals, including the BMJ. But I think it's fair to say that it is mainly medical journals, so that there are some CRGs who work mainly in other specialties who this may be a bit more of a change for them. The transition period, so between now and January, will allow us to assess the impact of this on those review groups in particular. So during the implementation phase, we are proposing that we give peer reviewers the option to opt out if they so wish, as long as they give a reason for doing so. And this will enable us to track those responses and see if any review groups are going to be negatively impacted by the move to a named peer review process, and we'll assess those towards the end of the year and before implementation in January. It's not our intention to make the peer review process more difficult or the recruitment of peer reviewers more difficult for CRGs, so we're hoping that that will enable us to, by assessing the responses of peer reviewers who are declining the invitation, that we can create a picture of where the barrier should be, what the main reasons are for not wanting to continue with a named peer review process, and what are acceptable and unacceptable reasons for declining the invitation there. So we have 2 flowcharts within the policy, when to peer review updates of protocols, and the main takeaway message here is that updates of protocols do not all need to go out for peer review. There are circumstances in which they are so similar to the original that additional peer review is not necessary. And when to peer review updated reviews, there's a secondary tree here, which takes us down to a conclusion of selective peer review required. So this might be where only a section of the review needs to be peer reviewed, or it might be where only one particular type of peer reviewer needs to see the manuscript again. So for example, that might be a methodologist or a statistician. And this is really to promote the management of peer review resources. We know that it's an extreme burden for some people to peer review an entire Cochrane review, so it's really to manage those resources as best as we can. The policy also states the minimum and type of peer reviewer required. So in the policy it states that every Cochrane protocol and review will be peer reviewed by at least one clinical or topic specialist, and a minimum of 1 must be external to the CRG editorial team, and that means they have no current role at the CRG. The protocol and review will also be peer reviewed by 1 statistician or methodologist, and in some circumstances it's appropriate for that person to be a member of the CRG editorial team. The policy and guidance documents go into a bit more detail about that, but essentially if standard methods are being used, then they just need to be checked that those methods are appropriate and have been followed by the in-house statistician or methodologist as appropriate. And we are saying that every review, we should aim to be having a consumer reviewer on every review. Now, we haven't gone as far as saying this is mandatory, because we know it's very, very difficult to recruit consumers for certain topics and specialties. But we are aiming to work towards that, and we are going to be working quite closely with the consumer group in the future to come up with a way of better integrating that within our regular peer review processes. But essentially, the number and type of peer reviewers will vary from review to review, and they can include content specialists, systematic review specialists, information specialists, methodologists, statisticians, consumers, and also other potential users of review. So thinking specifically about groups such as EPOC, where consumers aren't necessarily the potential user of the review, but it's more other healthcare professionals, just to make sure that we have a wide spread of people looking specifically at different areas of the review. The 4th point to take away is that we're mandating acknowledgement of peer reviewers on the CRG website. So as a minimum, the names of all peer reviewers who have submitted a peer review report or completed a checklist during the current calendar year, whether the review has been published or not, their names will be published on the CRG website in acknowledgement of their contribution, unless the peer reviewer hasn't consented to this. So within the peer reviewer forms and checklist, there is a section that asks the peer reviewer if they consent to their name being included in this way. And lists from previous years must be archived and publicly accessible from the CRG website. So we know that some groups do this already, and if you haven't seen it yet, I just point you to the Cochrane Wounds group for an example of a group that currently publishes an annual list. And I should also say that we acknowledge that there are many other ways to acknowledge peer reviewers. I know some groups also do printed certificates, and we've also said in the policy that we want to acknowledge that payment in certain circumstances is appropriate when the CRG has the funding to do so. So when there's a particularly quick turnaround or you need a particular type of specialist. There have been cases in the past where that's occurred, and we just wanted to make sure that it's known that that is a legitimate process as long as the CRG has the appropriate funding to do so. And in the guidance document, we go into quite a bit more detail about two online services called Publons and Orchid, which are services that peer reviewers can sign up to and receive credits for peer review against their academic record in a format that could be used for CVs, for example.